In November 2014, the Maternal and Child Health Bureau Division of Healthy Start and Perinatal Services hosted the 2014 Healthy Start Convention, a new era of Healthy Start, emphasizing quality and planning for success. This is a recording of the Introduction to the Healthy Start Model plenary featuring Suze Friedrich, Project Director of the Healthy Start EPIC Center.
Again, welcome. My name again is Suze Friedrich with the EPIC Center. I am going to take the next 20 minutes or so to orient you to what you can expect to hear over the next couple of days. The specific objectives for our meeting today and tomorrow is, as I mentioned, introducing you to the Healthy Start model and expectations for how you can align with that model. Really emphasizing how committed we are, both the program and the EPIC Center, in documenting the effectiveness of the Healthy Start program going forward. We know we have this wonderful 5-year window to be able to demonstrate how important Healthy Start is to the communities that we serve, and taking the responsibility of really generating the data to be able to document that over the next 5 years. As I mentioned, we are counting on you taking advantage of this face-to-face opportunity to make some connections with your peers. We know that that seems to be easily done with the amount of conversation that happened during that brief window, and we will provide more opportunities for you to talk to your groups over the course of the next couple days. And then finally, as I mentioned, we are using this conference as an opportunity to really better understand what your capacity building needs are and what some of your strengths are that you can share with us and be able to provide to your peers going forward. So I know a lot of discussion has been going on. The FOA indicated we have a new Healthy Start. There's a lot of questions about what does that model look like? How is that different than maybe what you've been doing in the past? I provide this definition of what we mean by a model. We basically want to express a model as a standard to be imitated, and we need to be able to describe what Healthy Start is all about, so that as we present that to others, the sort of stakeholders that are part of our extended community, we can very clearly indicate what do we mean by Healthy Start and why it makes a difference in the communities that we serve. It describes the way we do things. That's the way we want to be able to describe the model for going forward. And it really provides a framework for guiding our implementation of the program from this point on. As Dr. Liu reviewed with you, the FOA provided in detail what the 5 approaches are that really guide the program going forward. Those 5 approaches really describe what you're responsible for doing. That is the what we are trying to accomplish, the goals of the program. What we've done with the Healthy Start EPIC Center is to translate what your expectations are into how you're going to do it. So we have attempted to take this and be able to provide it in more of a step-by-step approach of how we then translate and achieve those goals through your program. We want to start by saying that Healthy Start is first and foremost a community-based program. There is no cookie-cutter, one-size-fits-all. In truth, it is more of an umbrella of facilitating linkage of clients to all the services that they benefit from to achieve those best health outcomes. So while it is not a one-size-fits-all single intervention, it is a standardized approach to achieving the program goals. And it's that approach that we are going to be sharing with you over the next day and a half, so that we're all on the same page in terms of what this program looks like, how we implement it, and what we expect in terms of outcomes as a result of following a similar path to those ultimate goals. So we had in our level 3 meeting in the last couple of days sort of a discussion of, what does this thing look like? I in no way want to describe the model yet, because part of what we will be doing, working over the course of the next few years is, next couple of years hopefully, is really clarifying what this model is with your input. But we see it as a interface between the client or the participant and a lot of community resources and services. And there's something that happens in that box, the Healthy Start program box, and then that process ends up making sure that not only are some services provided directly by you, but you're ensuring that that broad mix of programs that might be available in your community, those other evidence-based services, those other partners who are providing important resources, are linked to that client. And what we want to be able to do is describe how you ensure that those clients are getting that mix of services that they individually need for the best health outcomes. And that is the approach that we've laid out. We've used the acronym EPIC to describe how you're going to do your work. The EPIC addresses all 5 of the approaches. It's a little bit more catchy maybe, a little easier to remember, and it really sort of captures the work we have ahead of us. What do we mean by EPIC? It's a step-by-step. This is almost a continuous improvement model, which starts with understanding the needs of your clients, your participants. So the first letter in EPIC is E for evaluate the need and impact. This really addresses the approach of performance measurement, quality improvement, and program improvement. In order to understand the needs of your clients, you need to understand the needs of your community. You need to conduct some sort of a community assessment, understand what those health status and root causes of poor health outcomes are. And once you understand what the needs of your community are, then you can align your program to those needs. Second step in the process, and I have to say that that's a continuous effort. You can't just do a needs assessment once and use that as the basis forever for your programming. It's a process that gets reviewed every few years, every couple of years. You look at whether or not you're having an impact on your community, and you make those appropriate corrections to your program implementation to get those good outcomes that you're seeking. So the next step in the EPIC model is P for EPIC, for Partner for Collective Impact. Once you understand what those needs are, you can't do it alone. This is a huge undertaking to change decades of adversity for many of our participants. It requires a community-wide strategy to be able to truly impact the lives of our participants for the better. Collective impact is an expectation that you work across your community of stakeholders, partners, agencies who have other assets and resources to bring to the solution, and you work collaboratively towards that end. And you will be learning a lot more about what collective impact is all about and how to implement it in your communities. The third step is implementing evidence-based practice for the I. Again, once you have identified the needs, identified partners, come to some agreement on how we're all going to work towards that common agenda, we want you to implement evidence-based practice. We do not want you reinventing the wheel. We're putting together an inventory of those evidence-based practices, which will be searchable on the Healthy Start EPIC website. And we are going to be helping you to identify how you implement some of those practices where you may have gaps. So you may already be implementing many of these. Certainly in your grant applications, you indicated evidence-based practices that you had incorporated into your program. We want to build on those. We also want to make sure that over time we can use your experience from the field to see if there's some practices that are more effective to serve our participants than others, and how do we customize those evidence-based practices to truly meet the needs of our participants. And then lastly, considering the context for C, just as we can't do it alone, we know that 9 months is not enough to solve the problems that our participants face. This is a lifetime issue. And to be able to truly affect the long-term health of our participants, we need to be aware of the community context in which they live and address the social determinants and take a life course approach to their care. And so being able to reflect that in your collective impact efforts as well as in your implementation of your model going forward. So that's our EPIC, our EPIC. So it's evaluate need and impact, partner for collective impact, implement evidence-based practice, and consider the context. And they do address the 5 approaches, just slightly packaged differently, more in the how you're going to go about achieving program goals. You're expected to apply the EPIC components, those 4 components, across the 4 Ps of the perinatal period. And when we talk about the 4 Ps, we start with preconception, interconception as our first P. This is obviously women before and between pregnancies. It extends through the prenatal period, through diagnosis of pregnancy through birth. Postpartum period, which is your infants and mothers and their babies through 6 months, and ultimately parenting babies and their families through the first 2 years. So again, evaluating the needs, partnering for collective impact, implementing evidence-based practice, and considering the context, it applies to each of these phases in the perinatal period. So, as was mentioned, the Healthy Start program has really rethought how they can best serve you in achieving the ultimate goals of the program of reduced infant mortality, disparities, and improved maternal outcomes. And they have committed resources to provide you with capacity building assistance. And JSI has been tasked with creating that center, that resource for you to facilitate access to the expertise, resources of your peers, of outside consultants, of JSI staff, to be able to help you achieve those overall program goals. And when we talk about capacity building, as Nakiva mentioned, it really is building the skills, competencies, and abilities of you to achieve program goals at the community level. We are organizing our capacity building around the 4 components of the EPIC Center. So again, we will be helping you with the evaluation of your needs and the impact of your services, developing collective impact capabilities and your CAN, making sure that you know what evidence-based practices are available to you and how to customize them for your own participants, and addressing the social determinants as best we can within your communities.
Thank you for listening to the Introduction to the Healthy Start Model plenary from the 2014 Maternal and Child Health Bureau Healthy Start Convention. For access to the slides and more information on this topic, please visit www.healthystartepic.org.